Hi class, my name is Becky Benningson and I am giving you my report for my PE Masters 580 class. The subject that I selected was Female Athlete Triad. I specifically picked this subject because of conversations that I've had with family members, friends, colleagues, and it's typically not a specific subject that is brought upon in classes. But I really wanted to focus on this and kind of get you guys educated on it and kind of grow my knowledge on it too, since I am now a coach for a female team. So, kind of going with the history about it a little bit. In the 1900s, females were excluded from sports until 1972, when the Title IX law was brought out, and at this time, women gained strength, confidence, endurance, pride, and a lot more. Females were physically active. Most women weren't used to the fact that physical activity led to weight loss, thinness, and this kind of brought on female athlete triad. And when thinking about this, when somebody first talked to me about it, I thought, is this like a new trend that people are talking about? Is a new exercise workout? Is it a specific diet? Anything of that sort? But it was completely way off track. The website for Female Athlete Triad, it's their official website. They stated that it's a syndrome of three interrelated conditions that can lead to severe diseases. So it starts off with energy deficiency, whether that's with or without disordered eating, menstrual disturbances, and bone density loss. I'm going to kind of go through each individual step, but the signs and symptoms that most people need to be aware of are abnormal absences in the menstrual cycle, avoidance of eating or diet behaviors that change, a little bit of precaution with weight and eating, sufficient weight loss, decreased performance, stress fractures, anxiety, depression, and difficulty concentrating. Most of these symptoms can be misconstrued as something else, but being a coach or a teacher, this is something that we need to keep an eye on because of this specific syndrome. Energy deficiency. This is basically the amount of energy consumed, so what we eat, and the amount of energy exploded, so how much we exercise. One of the studies that I researched, there were 34 cases where there were 2,459 athletes and 8,858 controls. And this is where they found out that female athletes are at a higher risk of disordered eating than non-athletes. And elite athletes were generally more at high risk because the sports emphasized thinness, being physically fit. The way that they determined this, they had a number of non-athletes and athletes take a eating attitude test. This is where they were interviewed by doctors on questioning them about their specific diets and the amount of exercise that they're performing, and they assessed their symptoms. A lot of high performance athletes were more at risk depending on the questions that they asked. The worst case scenario is that it's most commonly progressed into more dangerous eating disorders like anorexia and bulimia. In relating to the energy deficiency, it comes into the female menstrual cycle. This can lead to a huge disturbance. The combination of low calorie intake and high energy demands really causes emotional and physical stress to the body. This is where a low percentage of body fat is caused and hormonal changes are going crazy. Usually when this happens, a female who loses their hormone levels will end up missing a menstrual cycle. And the way that it's determined if you have female athlete triad is if you're missing 3 or more menstrual cycles in the entire year. There was a case that Robert McComb performed that specifically questioned athletes on their energy deficiency and their menstrual cycle. So he had high school students and college students who were specific track athletes and had them fill out a questionnaire about their menstrual cycle. It had them talk about how often they had it, the time between, how heavy, how many days they were on it. And then he asked them specific questions on how much they're eating during the day, what are they eating during the day, how much exercise are they performing. And through the outcome, 14% were at risk for 10 or less menstrual cycles in a year, which is considered a female triad athlete. This percentage included athletes that had an energy deficiency. So there may have been athletes in this study that had menstrual cycles that were 10 or less in a year, but had a healthy eating habit. So those could have been misconstrued with any other reason, like stress or anxiety. But he did conclude that he talked with a couple of the girls in there and had them change their diet up a little bit, and it was reversible. They didn't reduce their exercise, but they did change their specific diet. Now, the third part is the loss in bone density. Now, when I was doing my research, there wasn't much research on why it happened, but I mean, the body can't be able to replace old bone cells with new healthy ones if they aren't providing the right amount of hormones and energy to the body. The website for Triad athletes, they talked about losing bone mass and bone density faster than you should sets a stage for stress fractures and onset of osteoporosis. The only thing is that it's irreversible. Athletes who are participating in intense exercise and not really working on their diet, they should be taking calcium supplements just to reduce this factor, and they should be attending physical therapy. In summary, we need to be eating more appropriate in the amount of exercise expended. Students and athletes who are more physically active, I think they need to see a nutritionist or a dietitian. This can be anyone else that's more interested in physical activity. We just need to be more aware of these signs as physical educators, coaches, professors, friends, family, anybody that can just relay this information on the bone fractures, the weight loss, menstrual cycles. If you see this, they need to be getting checked out. Some of the future research that I'm kind of interested in and that should be brought out to other people, and just some other factors, is just educating coaches and physical educators, health teachers, just about female athlete triad, because it's not really a topic that's brought up very often. I know I didn't learn about it until maybe a couple months ago when I found out a family member openly admitted that the reason why she had anorexia was because she had onset female athlete triad. I think that doctors, when patients come in, need to communicate. If their patient is saying that they're physically active a certain amount of hours in a day, in a week, that they need to talk about the nutritional facts and the risks, the outcomes of being that physically active and what they're eating. I think it should be required for schools to have nutritionists come and talk to them, especially to their teams, but also at local gyms, just to be aware of this specific topic. And I think that there should be more research on the reasoning why of bone loss and how to prevent it, because there are preventions on the eating deficiency, just kind of regulating your eating habits with the amount of exercise, and then your menstrual cycle that kind of leads with it. But the bone loss is just kind of, if it starts off with the eating habits, then how are we going to work with the bones? I just think that some type of research or case study needs to be brought up about this. So in conclusion, everything pretty much ties with the food we eat and how much exercise we're participating in. Educating athletes, also coaches and parents, about healthy eating habits and taking care of their bodies. As coaches and teachers and professors, families, friends, we need to track training performances and notice abnormal healthy habits and the signs and symptoms. We need to promote honest an open environment so that coaches can talk to athletes about this, teachers can talk to their students about this, friends can talk to their friends about this. We need to emphasize that weight isn't a factor in the performance and help these athletes realize that their health is more important than competitiveness. Thank you.